Cloud.
the cloud.
Okay.
Good morning, everyone. I'd like to call to order this meeting of the Texas State Board of Examiners of Professional Counselors. Today is February 11th, 2022 at 9:00 a.m. We are meeting today via Zoom. I'm public member Stephen Hallbauer. Dr. Taylor. Yes, Patrick.
I see Dr. Amuna is in the attendees. Christina, can you promote her?
Yeah, thank you.
There we go. Dr. Bradley, please introduce yourself.
Good morning. I'm Dr. Loretta Bradley. I'm a Horn Distinguished Professor at Texas Tech University in Lubbock, Texas.
Jamie.
And I'm a professional member of the board. And good morning, everyone.
Thank you, Dr. Bradley. Janie.
Good morning, Janie Stubblefield, licensed professional counselor, supervisor, and I'm a professional member of the board.
Brenda.
Good morning, LPCS professional member, Brenda Compagnone.
Dr. Amuna.
Good morning. Thanks for bringing me over again. I'm Dr. Leah Amuna, the director of the Student Wellness and Counseling Center at Texas A&M University, Central Texas, and I'm a proud professional member of the board.
Thank you. Pastor Roy.
I am a public member. I'm Pastor Roy Smith from Midland, Texas.
And Vanessa.
Hi, good morning. I'm Vanessa Hall, and I am a public member on the board.
Thank you. Chair notes the absence of public member Garrett Nairn, that he reached out to us beforehand, and the absence is excused. Christina, will you coordinate introduction of staff?
Absolutely. So my name is Christina DeLuna. I'm the board administrator for the LPC board. We have Brenda Skiff, who is the BHEC executive director, executive assistant. We have Victoria Benitez, who is our new LPC board attorney. Patrick Hyde is our general counsel. Timothy Spear is our operations manager, and Daryl Spinks is the executive director of BHEC.
Thank you. Item number 3 is approval of the minutes from our previous board meeting. That is now officially done via recording. So this will be the first time that we approve a recording. So make sure that we do it procedurally correct.
I got record.
Okay.
I remembered.
So,
Thank you.
all in favor of approving, or I need a motion to approve the Zoom recorded minutes from our February 12th meeting.
From our November 12th meeting.
November 12th.
I so move.
Dr. Muna with the motion, I need a second. Dr. Bradley with the second. All in favor of approving our minutes from November 12th, please raise your hand and say aye.
Aye.
Thank you. The November 12th minutes are approved. And do I need to go ahead and, do we need to approve September as well?
We've already done
Just need to sign it.
just that one. Just, yes, just sign that one.
Okay.
Thank you.
Okay. Item number 4 is board review and possible action regarding a couple of application reviews or denials. I'm going to go ahead and pass this over to Daryl to take the lead. Daryl, kind of explain the circumstances behind these 2 applicants, and I believe that if they are here and would like to speak, that we have designated 3 minutes for each of them that would like to speak.
Yes, sir. The reason these 2 applicants are on the agenda is every week I have a meeting with licensing staff where we deal with any kind of issue that comes up when we're processing applications and staff can't handle it or can't make the decision at their level. It comes up to me before to see if I can make a decision on it before we go on to the apps committee or the full board for a resolution. And one of the issues that has come up is these individuals have degrees. One of them is I think a clinical rehab degree, and the other is an addiction counseling degree. Both of those, when you look under our rules, they appear to be counseling degrees. And my first inclination when staff brought these two issues to me were, these are counseling degrees. We need to just go ahead and accept the degrees and move forward. But one of the things staff had told me was in the pre-BHEC days, this board had viewed those two degrees in particular as counseling related degrees. And I told Christina, I said, you know, I don't want to buck what the board has historically, how they've historically viewed these things, but at the same time, under the rules, I don't think we can view these as counseling related degrees. So I asked her to put it on the agenda because I wanted to bring this to y'all's attention that I think we need to be viewing these degrees. I mean, they're both CACREP accredited programs, or they come from CACREP accredited programs. I think we need to be viewing these degrees as counseling degrees. And so I wanted to make sure we brought this to you, put it before you so that you understood that this is how we're viewing it now under BHEC. And if y'all, you know, if you don't want us to view it that way, I need some discussion, or I need pretty good explanation for why we shouldn't view them as counseling, but rather view them as counseling related. And it will also give you all the opportunity to say, well, look, we want to keep the way we were doing it, so y'all need to initiate some rule changes needed to make that happen. So that's why I'm bringing it here before you. I'm going to shut up now and let y'all discuss it and ask any questions. But it's our view, staff's view, that we really need to be viewing these particular degrees as counseling degrees, because again, they're coming from CACREP accredited programs.
Daryl, it's my favorite part of the day when you say you're going to shut up. I love that part. I don't know how everybody else feels about it, but I love that. It's like my Fruit Loops in the morning. It's amazing.
Daryl, do you want to hear, if either of these applicants are here, do we want to hear from them before we begin any discussion?
You know, I would almost say that I would like to kind of get some impressions from the board about how you view it, because if y'all tend to agree with how we're viewing it now, that I think that's going to cut the amount of discussion we have to have on this topic very short, because we can just go with how we're interpreting it now. I think where we're going to want to hear from them is if the board wants to continue viewing these as counseling related degrees, then we need to hear from the applicants and the individual stakeholders and kind of have a dog in the fight.
Okay, can we, Dr. Bradley, you are at Tech, and that's where these two come from. Can you give us a little bit of insight, being as you've got kind of some specific knowledge on this?
Let me say, yes, I'm at Texas Tech, and these two degrees are at Texas Tech. They're at the Health Sciences Center, and I'm on the main campus. So the two departments, you know, are separate departments. I was going to disclose this later on to see if you all think I have a conflict. I don't think I do. But basically, CACREP accredits counseling programs, and they're in the accreditation business, and we are in the licensure business. I looked at these programs, and I think they're counseling programs, and here's why. I looked at the coursework, because I don't think our board says because they're CACREP accredited that they're that they're automatically licensed. So I wanted to see the courses, and when I looked at the courses, they looked like counseling courses to me. Now, having said that, I did find a couple of courses that I was surprised was missing. And that's the, on one of them, the family course, and on the other one, the family and the abnormal. That I was surprised those courses weren't there. But if when you go to the website, they are courses that can be taken. An issue here is this program, and I have nothing but what I saw looked good to me. The program was accredited by CACREP in 2021. Now, CACREP allows that if someone graduated 18 months prior to the program receiving accreditation, that this is considered a CACREP degree. My only question, and I don't even know if it's that pertinent a question, would be, did both of these individuals graduate from the program with the courses that CACREP approved? Because obviously, if you graduate, okay, they were approved January 2021. And if you graduate, say in August, I believe one of them did, maybe both of them, I don't have that written down, then you started the program before the program was accredited because you couldn't complete it in 6 months. That's not an issue for me. I'm just asking, when they started the program under what I would call an original program or an older program, and then when they graduated, did they graduate with the courses that CACREP approved when the CACREP site team, or whether it was a virtual team, was on campus? But it looks like a counseling program to me.
So Daryl, if I understand this correctly, we probably considered these degrees counseling related in the past because they've only been CACREP accredited for a year now, like Dr. Bradley said. And so the circumstances of how we view the degree are now different. Is that correct?
I honestly don't know why the board viewed them as counseling related in the past. I couldn't tell you. But, you know, I just, as we sit here now, I'm like, I don't know how we can say they're not counseling degrees.
Dr. Muna?
I'll defer my time to Janie. Her hand was raised first.
Oh, go ahead, Janie.
I have a similar question to what Dr. Bradley is raising. Is in that CACREP accreditation, was the program adjusted? Did they add other classes, require changes in the coursework and things like that? And so if these were pre that accreditation, is that why we're looking at the individual coursework and considering them counseling related? From what I understood with the literature that you sent to us, Christina, from CACREP, that CACREP only accredits counseling related counseling programs, not counseling related, but counseling programs. And so for the BHEC licensing staff to then look at a CACREP program as a counseling program. Is that the way I understood that literature?
That's how I understood it.
Okay. So then the question is, what if anything, if the program was changed as a result of going through that accreditation? Did they add add courses or just courses, and therefore historical stuff? Do we then grandfather that in, or is it this program as of January 21?
Go ahead, Dr. Amanda.
I would first, let me just agree and co-sign with Dr. Bradley. I do believe reviewing the transcript for me before the program, before CACREP, I was just, let me see the transcript, let me see the courses. And they do appear as CACREP would have credited for them to be counseling. Having not been on the board in the past, but being involved in legislation in Georgia in the past, we have made addiction related programs that were not CACREP counseling related, because there are times where you can graduate from an addiction counseling program that is not CACREP accredited. So I think the issue here is if it's CACREP accredited, they've already done the work, like Dr. Bradley mentioned. they've done to work to make it counseling. But I would be wary of adding a blanket counseling approval to programs that just have addiction counseling in the degree, if that makes sense. So if it's K-CREP accredited, I would be like Dr. Bradley, we're not in the process of accrediting programs. If they says it's counseling, it's counseling. But if it's just an addiction program that may or may not be K-CREP accredited, then we keep it on the related degree side.
May I add one thing? If y'all look, the program that I teach in and direct is K-CREP accredited, and it's been K-CREP since 2000. And before I came to Texas Tech, I was at Vanderbilt. That program prior to that was K-CREP. And so I'm fairly familiar with K-CREP. K-CREP accredits programs, I believe, in 7 areas. Like they accredit marriage and family, they accredit in career, they accredit in rehab counseling. Probably the one that they accredit the most in is clinical mental health. They accredit in school counseling. Now, school counselors typically are certified, you know, like that, but also K-CREP does accredit school counseling. Our program here in school counseling is accredited. So there's 6 programs. Marriage and family is another program that they accredit. And they only accredit counseling programs. But I think it's more than accreditation. We're in the business of licensure. And that's why I wanted to see what the program is. Dr. Amuna said, and as Janie said, I wanted to see what the courses are. And it looked like a counseling program to me, although there were 2 courses I was surprised that I couldn't find on one of the transcripts. I could not find a family course, and I could not find an abnormal, or some people call it dysfunctional behavior course. So having said that, it looked counseling, but I didn't find those 2 courses, and that concerned me a little bit.
And if I can add, if I can add Dr. Bradley's concern about those courses, when I've attempted to get licensed in other states outside of Georgia, South Carolina, abnormal or dysfunctions has always been that mandated course. And so that basically lets you know that the counselor is able to deal with things that are not the run-of-the-mill anxiety, depression diagnoses, but more severe level counseling. And usually with addiction, there's going to be a comorbidity. There's going to be addiction and some other severe things sometimes. So that's why Dr. Bradley's concerned, if I can speak for you, Dr. Bradley, that concern is there for abnormal not being there.
Brenda, go ahead.
So I agree with everyone. I've looked over the transcripts and I see everything there that, you know, needed to be taken with, again, the exception of a couple of courses. Really, I mean, we would probably just in the past have requested syllabus and just sort of looked at the details of it, because sometimes not everybody has, you know, the same name to the class, but they look fine to me. I don't see why there's anything else to look into further other than they look good.
Okay. Dr. Taylor, anything to add?
No, Mr. Chair, looks, I mean, I reviewed the documents. It looks good to me.
So Daryl, are you asking us to draw a bright line that says if a degree is K-CREP accredited, that staff should consider it as a counseling degree?
Yes. And the reason for that is it makes it much easier to process applications, and we don't have to, if we don't do that, you know, I'm afraid we're going to have to run people through the counseling related degree process, whereby we have to verify coursework. I think what we need to do, just after listening to y'all talk, I think we probably need to initiate some rulemaking where we make it clear in rule that if you come from a KCREP accredited program, that degree will be considered a counseling degree. And then it's just clear in the rule. And that's a very definitive statement. It's easy to apply and easy to understand. And then that way, if somebody comes to us with an addictions or a clinical rehab degree and it's not KCREP accredited, they would then have to go through the counseling related degree track. Now, you know, I don't know. I don't know how y'all feel about that. If that's a good idea or not. Apparently it's fairly common for these degrees to be missing that psychopathology or the abnormal psych. Is that's kind of what I'm hearing, or that's what I took away from all that discussion.
Abnormal is not one of the KCREP core areas. It is part of, I believe, human behavior. It is not a specific list of the 8 core areas.
Which is kind of weird considering we require that of our counseling related degrees, but not of our counseling degrees. To me, that's odd.
That was one of the questions I had in rules committee. I asked, okay, committee, do we consider this so important that we require it in addition outside of the 8 core areas?
Yeah.
And they told me yes.
Yeah. So that part's a little strange how we basically require less of the folks coming in with a counseling degree than what we do of the folks coming in with a counseling related degree.
I don't think that's accurate though. I mean, the requirements are the same.
Even though they don't have the same coursework, folks who come in from a KCREP program without those courses.
The rules state the requirements as the same. The only difference is that if they have an accredited counseling program degree, then we just don't review the transcripts. That's it. The requirements are still the same. The schools are still required to offer those courses, and the students are still required to take them.
So even in a KCREP accredited program, even though it's not needed for accreditation, the school still has to make them take the abnormals.
I mean, that's the way our rules read, unless I'm
I don't think that's how our rules read. Christina, is it?
I mean, it's really up to interpretation, I guess. But if it comes through as a counseling degree, we don't look at the coursework. If it's related, we're going to look for everything that's in the rule.
Right. So we don't look at it, but it's still there. It's still required.
Yes, that is correct.
We just, and the argument when we made that rule or made that change was that we trust the universities, we trust the programs to do this, that if they are going to be accredited, that they are going to offer these courses. So we believe them. We're not going to add that scrutiny to every applicant, because that was causing all the large delays. That's why we had 6 months, 8 months delays and hundreds of applications getting pushed back.
So the university would need to meet the requirements of KCREP as well as what's outlined in the board rule.
Right. And if it's a counseling degree, we just make the assumption, we say, okay, well, they've done all this stuff because they have a counseling degree. So we're good to go. We're good to move forward. My hesitation would be adopting the language KCREP. I think that puts the state to favor a private organization over others. And I think that creates some issue, just adopting the specific language KCREP. But I think accreditation in general, I think, is good.
Brenda, I think you were next.
So if for those who are determining whether this should be acceptable or not, and the language isn't clear, then it would be good for us to make sure that language is clear. But I'm with Dr. Taylor. I understand it exactly the same. It's clear, it's there. So Daryl, if for those who are reviewing this are still uncertain about whether it meets the requirement or not, and we need to go back and look at that to change the language, I mean, I'm fine with that. But as far as, and as long as I've been on the board with the rules, I'm with Dr. Taylor, it's pretty clear.
Dr. Bradley?
I think I agree with most of what's been said. But if you go back to the KCREP document and you look at, okay, there are 6 programs that KCREP accredits, and maybe it's 7. I have to sit here and count them. I've got the KCREP rules right here in front of me. Okay, the clinical mental health KCREP program is the one that aligns most closely with our Texas board rules. For example, some of the other programs that KCREP accredits do not align with most licensing boards as clearly as the clinical mental health. So you've got to look at those. If you look at the KCREP manual, it separates them out as separate programs. Now, in reference to what Dr. Taylor said, I believe there are 4 states that now say that they will not license a counselor. And I'm not suggesting we do this, but there are 4 states that only license counselors who graduated from a KCREP program. I know Kentucky is one. I believe Ohio. Someone would have to look those up. But if we went that route, I would recommend that we talk to those states who've gone that route and see if that's worked out well or if it didn't work out well for them. I'm sure KCREP would know that very quickly, which 4 states. And there was a 5th state was looking at it. I'm not sure how many states, but I know some of them have. So what I'm saying here in summary, what I've said, KCREP accredits, let's say it's 7. It's 7 distinct counseling programs. One of them is in marriage and family. One is in career. One of them is in clinical mental health. One of them is in rehab and so forth. Those programs have their own specific standards. In other words, the standards for clinical mental health are not identical to the other standards. Sections 1 through 4 of the KCREP manual, they would all be expected to meet those. But then there's the different standards that apply to each of those programs. Am I making sense here? Because it's KCREP accredited, the standards for, let's say, addictions counseling, while there's many similarities, there are many differences in the 2 programs in the clinical mental health. And it's the clinical mental health program that seems to me to most definitely align with state licensure. That's not to say the others cannot or don't, but I'm saying you've got to look at the different programs. And that's an important thing for us to consider. Maybe not here today, but before we make any major decisions, I encourage us to know the differences in those programs.
Thank you, Dr. Bradley. Mr. Chair, if you could, what is a specific item on this agenda? Are we just talking about these 2 specific applicants, or are we talking about the larger issue? What is the specific item on the agenda right now?
The specific item is with the 2 applicants. We need to vote whether we will consider the degrees that they have to be counseling degrees. And so that approves their licensure.
Great. My concern with this is that this is a very large conversation that we definitely need to have. But I don't want to hold up these 2 applicants because of that large conversation. So I'd like to make a motion that we approve these 2 applicants and then move forward. And we can discuss this today if it is allowed, or we can set it for the next meeting or have it in the rules meeting.
Point of order, Mr. Chair. is that okay for a point of order? Okay. I'm at Texas Tech University. These applicants have a degree, not from my program, but from the Health Sciences Center. And it's all part of the Texas Tech system. Should I vote or should I abstain?
That's probably a Daryl decision.
Carol, unless Dr. Bradley was one of the professors, I don't see how there's a direct conflict.
Yeah, Dr. Bradley, I don't see a direct conflict here. I don't see any conflict unless you feel like your association with Tech would somehow prejudice or bias your decision making in this. You're fine.
Okay. Dr. Taylor
Okay.
has made a motion that we approve the two do we need to state their names on the record?
Yeah, please.
That we approve the applications of Chanel Nash and John Vickers. And I need a second. Okay. Brenda has seconded the motion. All in favor of approving?
Can we have discussion?
Oh, sure.
Would it not maybe be prudent of us to do some of our later agenda items, which talks about some of this coursework versus making this decision, which may have a kind of, I mean, because if we approve these, but then later don't approve other applications that are in the same scenario, it seems like we'll be contradicting ourselves. Maybe that we table the vote on these two particular applicants instead of setting precedents for other applications. That's my discussion.
Yeah, I think that's a good point. But each case would be unique. So I don't know that we would necessarily be setting a universal precedence with these approvals specifically. But we can definitely approach that.
Dr. Bradley?
I agree with Janie. One point I failed to mention that KCREP does require that abnormal be taught within the program curriculum, but they don't require a specific course. And I don't know why I left that out, but I agree with Janie.
Hey, Dr. Luna?
So my question essentially is, if we were to vote on these applicants, are we saying yay or nay based off of the coursework that they have presented, off of the fact that they're KCREP accredited, all of the above, or off of something else? I'm just curious.
It's my understanding that we're voting yay or nay based on the degrees that each applicant has, that we would now be considering those degrees to be true counseling degrees, and then subject to the standard of review that true counseling applicants receive.
Okay, so then I needed that to decide whether I feel there is a need for more discussion, because if we're saying based off of their individual specific transcript that they meet that criteria, then we're putting a stamp. But if we're saying anyone in this program, we're putting a stamp, then there would be a need for a greater discussion. So I was just trying to see which route are we taking? Are we individualizing these two people? We're not setting a precedent. We're just saying they meet right now. Or are we saying their degree, their program meets, and that's why we're approving?
That is my understanding. One applicant has a Master of Science in addiction counseling, and one applicant has a Master of Science in clinical rehabilitation counseling. Both of these are KCREP accredited as of January of last year. And so in the bigger sense, we are determining whether, if a degree is KCREP accredited, will we view it as a true counseling degree and therefore subject to the counseling degree level of review when they apply.
So that's my challenge. Like if we were to just say, based off what they have today, I would be semi-comfortable voting. But if we're saying we're making the rule now that if it's KCREP, it's automatic, I wouldn't be comfortable with that. So if someone came next month through this exact same program with the exact same courses, I would be comfortable. But if someone came from another school with a similar name and different classes, I can't say that I would have the same level of comfort.
What if that other applicant came, what if they came from a K-Prep accredited program?
So if it was a K-Prep accredited program, then my question would be what track? Because if they were rehabilitation sciences versus clinical mental health, there could be vital things on their transcript that they don't have. The transcript is what sells it for me today. The individual's transcripts that I see sells it for me today. And if the transcript is similar, then I'm comfortable. But if there's any difference in that transcript, even though it's K-Prep accredited, my comfort level of that vote would be different.
Yeah, Mr. Chair, if it might clear things up, I'd be happy to restate my motion to make it a little bit more clear. My motion is that we approve these two candidates as counseling degrees, these specific ones as counseling degrees, not K-Prep, not the universities, not anything else, just these two candidates, these two specific degrees, we view them as counseling degrees. That is my motion.
Yeah, we can keep this scope of this decision narrow at this point and save the larger discussion for another day. We can limit it to these two specific applicants. Brenda?
And that's all that I wanted to say, as well as that I'm just specifically looking at the applicants, their transcripts, period. We can look at it holistically later if we need to, but for today, we're just only looking at what they've submitted and what's pretty clear to us.
Yes, Dr. Bradley?
Okay. K-Prep, I come back to it again, is accreditation and we're licensure. And how do we resolve, and I don't know if this is an issue for everyone, but I want to come back to it. You cannot look at K-Prep. It's just one accrediting body. You have to look inside and see that there are 7, let's call them tracks, or 7 accrediting areas. Now, the issue for me today is 2 of them don't have the family course that our licensure speaks to. And one of them, I couldn't find the abnormal that our licensure speaks to. I'm just asking for clarification. How do I resolve that? Because I want to be fair across the board. I don't want to say some people have to have abnormal and family, for example, and others don't. So that's an issue for me.
Brenda?
Dr. Bradley, would it satisfy you, or would it suffice if you were able to look at the syllabus, the breakdown of those courses, the ones that are in question? Also, maybe having them speak before us to ask, why didn't you take the abnormal? Would that be a better route for us to take? Would that make you comfortable before?
Yes, I would like to hear if the applicants are here. But again, I want to go with what the majority of the board want. I mean, I just have trouble that some people have to have the family course and abnormal. That's part of what we say for licensure. And maybe I missed it on these 2.
Dr. Amina?
I was going to say, in reviewing one of the applicants, there's psychopathology, and psychopathology is sometimes allowed to be taken in the absence of abnormal. And so there is a verbiage that attests to abnormal in the form of psychopathology on the transcript.
And I agree with that. I taught psychopathology last summer. Now, we thought in our program we had to have both abnormal and psychopathology, but I agree there's overlap.
Patrick?
Yeah, to Dr. Bradley's point, I just wanted to point to the actual rules that we're looking at and trying to apply here. And 681.83 is the particular rule that I think is in play. And in subsection A, it states if the degree is in counseling, then it's presumed to have met all of the coursework requirements. And so we don't look at the subsection B requirements that list out all of those coursework. And so to Dr. Bradley's question, if she's concerned there's not something on that list, well, that's the way you answer that is if it fits under A, sub A, if it's counseling, then you don't need to even look at B. So you don't need to go through that long list of everything. I think the part that staff is struggling with is when we look at a degree and it has counseling in the title, there was a presumption on some staff, not necessarily all, that is a counseling degree. And the part that's then difficult for us is we look at, there's an accrediting body that's accredits counseling programs, and it says this is hereby a counseling program. And our rule as it's written right now says if it's a counseling, if it's a degree in counseling, and KCREP is called it counseling, why staff is looking at saying, why is that not a counseling degree that falls under A and not B?
Dr. Bradley?
The answer that I would have to that is that KCREP credits 6 programs, so they have different standards. The one that most clearly aligns with licensure is the clinical mental health. So let me say into this statement that if it has counseling in the degree, I started as my career as a school counselor, and I'm very pro school counseling. But a school counselor does not necessarily meet, it has the word counseling in the title, but it does not necessarily meet the licensure standards unless they have taken special courses. So I do not agree that just because it has counseling in the title, that it's ready for a licensure. You have to look at the degree and the requirements within it. And this is not against school counseling. I am very, very positive on school counseling, but I use it as an example. A school counseling degree would not have the requirements necessarily for licensure. So because counseling is entitled, you can't automatically assume that.
Right. I understand exactly what you're saying. The problem is I'm looking back at what way the rule is drafted and the wording of the specific wording of the rule. And the wording of the rule doesn't have what you're saying, Dr. Bradley. It doesn't have the standard that you're talking about. It says if it's in a graduate degree in counseling, how do we draw that line? We have a definition for programs that are counseling related, but that talks about psychiatry, psychology, MFT, social work, but we don't define this. And so there's not really any clear guidance like what you're saying. You're basically saying you want to look at coursework to determine if it is counseling, but that's not the standard that that particular rule lays out.
I guess I didn't say it correctly, Mr. Hyde. What I was trying to say is you cannot just take, I thought you were saying if counseling's in the title that it's automatically counseling. And that's the part I was reacting to. Like people have doctoral titles. In medicine, it happens all the time. And if I have a health problem that's a heart problem, even though the person has a doctor title, I'm going to make sure that they are board certified, in this case licensed, for what they're practicing, and I'm going to look for that specialty. So that's all I was trying to say. Counseling isn't the same across the board. We know counseling is used in different ways.
Yeah, Patrick, I would not want to use a evaluation threshold being whether counseling is in the title. I feel as though the threshold should be KCREP accreditation.
I think that's heavy weight towards it being counseling. Absolutely. If it has, if the accrediting body from counseling programs is calling the program counseling, it's, to me, a strong indication that that's in fact a counseling program. So
If you have a Master of Science in Psychology, is it a KPREP accredited degree?
well, KCREP doesn't accredit psychology courses, and
Okay.
we have
But
We
specific,
have somebody else.
that's what I'm saying.
no, but
That's very clearly counseling related at that point.
right, but that's what we would go
We're
to.
talking about Master of Science in Addiction Counseling, Master of Science in Clinical Rehabilitation Counseling. Both are KPREP accredited programs. There's the clear line. Yes, Dr. Amuna?
I'm actually struggling. I'm struggling with this issue because I want it to be as efficient as possible for people who are coming through to get licensed. I want to make sure it's as least taxing for our staff who has to do the processing, but I also just kind of want to make sure we get it right. And the thing that comes to mind for me listening to Dr. Bradley is in regards to, like, for example, career counseling. I used to do career counseling, and in career counseling, there was no abnormal psychology. There was no group therapy. There was no individual counseling. I had to know about the markets. I had to know about resumes. I had to know about speech and dialect and projection. But there are so many practical clinical skills for one-on-one individual mental health counseling that was not involved in that job. That would never be a part of that job. If someone's coming in for career counseling, I wouldn't say, tell me what happened to you when you were 2, right? I wouldn't say, tell me about your hallucinations and your delusions. I wouldn't do those things that are innate to quote unquote true clinical mental health counseling. And I feel like our license leans more towards clinical mental health counseling versus some of the other things that are like career counseling. And I don't know if KCREP accredits career counseling, but if they did, I would be like, absolutely no, unless I see a transcript that I'm going to put you in a room with someone who has a severe diagnosis and say you're going to counsel them. So that's my struggle with giving it all to KCREP if they accredited something in the form of counseling that has nothing to do with the intensive clinical mental health work that we do. And I just, is my standard is, if you were working inpatient at, I'll pick on Darnall, our military hospital. If you were working in an inpatient hospital, could your degree get you through a 12-hour shift on the psych ward? If it could not, you probably need to have some teasing out of your program before we grant licensure.
One thing to keep in mind when debating this issue is you got to remember what all we consider to be the practice of counseling. And as Tech points out in one of their letters, I mean, we consider, addictions counseling, rehab, all of that is the practice of counseling. So you got to keep in mind that if you say this is not a counseling, it cuts against us, I think, if we ever had to go over to SOA, if we're saying, well, an addictions rehab counseling degree is not a counseling degree. Well, is it considered the practice of counseling? Yes, it is. But this degree is not a counseling. That cuts against you, I think. If you're saying that, well, only, our licensure is geared more towards the licensed clinical mental health counseling. I don't know that I necessarily agree with that, because our rules are pretty clear that we encompass all these forms of counseling as well. So we just got to keep that in mind.
And I'll caveat, Daryl, and say the two before us are, if I can go ahead and present, are an easy yes to me. The two before us today are an easy yes. My concern is about making a blanket statement, and that's why I brought in career counseling. But addictions rehabilitation, as presented before us today, are an easy yes to me. My wrestle is with making a blanket statement with regard to KCREP.
Right, Dr. Amuna, that's why my motion, which is still on the floor, Mr. Chair, is specific to these 2 degrees, and that we have that larger discussion later. So, Mr. Chair, just a reminder that the motion is still on the floor.
Okay, Dr. Bradley?
I agree with what Dr. Amuna said. And I'm comfortable, Dr. Taylor, with your motion. I just need a little bit more discussion here. I'm comfortable with what I've reviewed, what I've seen, and so forth. But I'm not comfortable making this in any way a blanket for all KCREP accreditations, because that's the reason that KCREP has broken them out into 6 distinct categories, because of their emphasis.
Okay. I will allow the applicants 3 minutes to speak if they are present. We'll start with Chanel Nash, if they're present and want to speak.
Good morning, Ms. Nash. If you would like to speak, you are more than welcome. You have 3 minutes.
Thank you. I appreciate it. 3 minutes is not a lot of time, and I'm new to this part. So I want to thank you all for fitting me into your schedule. It means a lot that you're willing to meet with a couple of emerging counselors when only a few of us are having this problem. You know, I had a whole speech prepared, and, you know, listening to you all speak, I got to tell you that it has been a lot of ups and downs for me. I want to say that, you know, KCREP accreditation, yes, is one layer, but nobody has spoken to the NCE, which is the licensing exam, that is stated to say, okay, you have got this, you know, you are capable of practicing. I made a 116, which is 25 points above what I needed to graduate, or what I needed to pass. And that is in no small part because of the program. I believe that to have a specialty in addictions is to have a specialty in abnormal behavior. And to have a specialty in addictions is to have a firm understanding of generational trauma. And it is embedded in every single course. If you look, I mean, I can't show you, but I keep everything. I keep everything. Every paper I ever wrote, family is in there. Abnormal behavior is in there in every step of the way. You know, I am also an NBCC fellow. I got that big $15,000 scholarship that trained me in minority populations. I have had my transcripts reviewed by Rick Levinson, which is an EMDR training facility. I have to be on track for licensure to get those trainings while I'm in college. They reviewed my transcripts and said, okay, we can train you. I wanted to be able to represent the entire continuum of trauma. Addiction and trauma are both my specialties. And so I also got neurofeedback trained, because, which you have to have a bachelor's for that, but I wanted to be able to treat the entire continuum of trauma for people that aren't ready for it, all the way to the people that can do it with rapid fire and are in that place. I've owned sober living in San Antonio for almost 10 years now, 9 years. And so I don't work with alcoholics and addicts. I work with people who happen to be alcoholics and addicts. And it is my philosophy, as well as the program's philosophy, that you have to understand that a holistic approach to the person is meaning that you do not define them based on the presenting problem. You have to look at everything, the ideology of their addiction, their parents, their grandparents, their family systems, how those scripts and those narratives that were written in their family systems generated who they are today, because we're doing downstream services. We're on the front lines. Upstream services are where my kids are in school and they're saying, hey, say no to drugs. That's upstream, but we've already gone past the trauma. We've already gone past the depravity of what addiction can do to people. And that's what I've been treating. I got this degree to add value to the job I was already doing from a clinical standpoint, because there is a disparity in what is going on in our communities in Texas, San Antonio particularly. And I started doing this when the narrative was, you can't get sober in San Antonio. I'm not saying that you all don't have a big decision to make. And I know that you all are thankfully saying that this is for me and for the other applicant here, because I feel like I got caught in the crosshairs of a much larger issue of an incongruency in language or rules or whatever, but I've done everything that was asked of me. I graduated with a 4.0. I went above and beyond and got all the other education so that I could be the best counselor that I can be early in my career.
Ms. Nash, I'm sorry to cut you off, but you have reached your 3-minute time.
Thank you. I'm done.
Speaking, I wanted you to be able to address the board directly.
Thank you.
Board, if there's any specific questions for Ms. Nash, we can entertain those. Otherwise, we will check to see if the other applicant is present.
Congratulations on passing the test.
Would you like the other applicant or the university?
Mr. Vickers, please.
Okay.
Is he here?
Yes.
Okay. Mr. Vickers, you will also have 3 minutes to address the board.
Thank you so much. Hopefully you can hear me.
Yes.
Well, thank you. I just kind of want to second what Ms. Nash is saying is I myself, worked really hard and met all the requirements that my program asked of me. And I also passed the NCE and my CRC test. So I can be that counselor. And when I'm receiving emails stating that, I don't meet licensure requirements, and then I receive a license, my state license in the mail, that I'm asked to dispose of it. And, it's just very frustrating. So hopefully the language, semantics and stuff can bring clarity to future applicants, because it's very disappointing.
Apologies, Mr. Vickers. Will you please clarify that? Are you stating that you were issued a license by the state of Texas to practice therapy?
That is correct.
Okay. We need to discuss that, Daryl.
And then it was asked of me to shred or dispose of the license.
Yeah, he was issued a license on accident. It was just a straight up accidental error on staff's part. And then, of course, we asked him to destroy the license because it was issued in error.
And I was also listed on the website as well as having an active license.
That is most upsetting. I do apologize for that issue on the board's behalf.
Thank you.
Mr. Vickers, anything else? You have a little time left.
I have no further comments. Thank you.
Okay. Mr. Vickers, as chair of the board, I apologize for that error. Obviously, staff strives for 100% accuracy. That doesn't happen all the time. We apologize for that mistake. We do have a motion and a second on the floor. Is there any further, Dr. Bradley, further discussion?
I have one question, if I may, Mr. Chair, to ask to both of them. And I'll state it and you tell me if it's okay. I want to know if both of you graduated. I know you started the program before it was KCREP accredited. When you all graduated, did you take the courses that KCREP approved, just like they approved the courses for accreditation? I've been on KCREP site teams and approve those courses. And I know if you start a program, you get to continue with the program usually that you started. So all I'm asking here before I vote is your program, did you complete the exact program that KCREP approved for accreditation?
Yes.
I can actually answer that if it's okay with you all.
Please proceed.
Yes, so it is my belief that the coursework that I started out with was the KCREP accreditation. I do not believe any changes were made to the actual courses. I was actually one of the students that KCREP spoke to about the program when they were finishing up their review. And the person that was doing the review had nothing to say to us but a glowing review of all the hard work that the program had done. I had a little bit of trepidation starting a non-KCREP accredited, but I had faith when I looked at the coursework that it was going to be a smooth transition. And the only thing that held it up was COVID. And so Texas Tech is also here, but it is my understanding from talking to KCREP directly that what I started with is what they finished with.
Okay, then that satisfies my question.
And Mr. Vickers, you can respond if you would if you would like. It's still there?
Yeah.
Thank you, Dr. Bradley. Mr. Chairman, I do believe, yes, I did graduate in May of 2021, which the program was accredited, my understanding, in January of this same year.
Okay.
Thank you.
Thank you, Mr. Vickers. Again, board, we do have a motion and a second. Is there any further discussion? Okay, just to review prior to the vote, Dr. Taylor, will you restate your motion with the limitations that you did impose on that, so we can all be very clear on what the vote is?
Yes, Mr. Chair, it would be my pleasure. Christina, can you give me the two names again, please?
Chanel Nash and John Vickers, or Vickers.
Mr. Chair, it is my motion that these two individuals' degrees be viewed as counseling degrees and issued a license to practice counseling in the state of Texas.
Okay, that motion has previously been seconded. So this time we will vote. Please raise your hand and state aye if you are in favor of the motion as presented.
Aye.
Aye.
Aye. And those opposed? Okay, seeing none, the motion does pass for both Ms. Nash and Mr. Vickers. Thank you for your participation today. At this point, we will go ahead and move on with agenda item 5. Orders executed by the board chair. Christina, do we have any?
There are none for the board chair.
Mr. Chair, before we move on to the next item, if we can, please, Christina, Daryl, will you please add to the next agenda discussion on how to handle licenses that have been issued to individuals erroneously? Because my understanding is that once a license is issued, it cannot be revoked without our authority. So definitely want to review that with staff.
Thank you.
Dr. Taylor, we'll move on to item 6, first quarter orders. Christina?
Yes, so you all do have 6 orders there in front of you. Again, we did just get Miss Victoria Benitez not too long ago, so she's getting used to the whole spiel for LPC, and we'll quickly be adding to these numbers for you all. But these have already been executed by the BHEC Executive Director. So no action for the board needed.
Thank you. Item number 7, we had a petition. Patrick, can you present the petition and frame the discussion for us?
Sure. Mr. Eli has a petition here that was discussed with the Rules Committee. There should be a draft written response, I believe, in your board materials denying the petition. Trying to find that. Christina, is it in the board materials?
It is.
It is.
So Patrick drafted a response to the petition, and the board was presented with that response. And at this time, the board needs to determine if they agree with what was proposed from Patrick, or if they disagree and we need to draft something else.
I think in short, what Mr. Eli was wanting to do away with was the rules pertaining to the 5-year limitation on the national exam scores, and he was wanting to get rid of the bar, basically the 5-year limitation, essentially saying if you passed it once, you passed it, and you don't need to pass it again if you're reapplying. I think he was an LPC associate, and he had to extend beyond 5 years, and he didn't want to have to retake the exam, I think is the short version of what he was talking about.
So he is proposing that instead of having that 5-year deadline, that there is no deadline, that your score is good forever.
Correct, that you, once you pass it, it's passed, and yeah, it's good forever. And Rules Committee had when we discussed it, was not in favor of that rule change. So that's why the draft letter says to deny the petition, but it's for discussion.
Okay. 5 years sounds like a long time coming from a public member perspective, but if I'm mistaken on that position, please explain.
Patrick, I'm definitely not in favor of a rule change for that, but I was under the impression that that was the barrier to entry for the LPC associate license, not for the LPC license. So once they are issued the associate license, as long as they maintain that license, that they don't need to retake the exam. Is that not correct?
But I think you're correct. I may have misspoken. I think he had an LPC associate license. He went beyond the 5 years. He had to come back to continue to get his supervised experience. And so when he was coming back, he didn't want to have to retake the exam for that. So sorry, I think I misstated that.
For clarification on that, that associate license was essentially died, right? It was not renewed. It was not given an extension or anything.
I don't know the details specifically, but I think that's correct. Do you know more details, Christina?
As far as I understand, he just did not complete the hours within the 5 years. I don't know the reason for that, but there's no rule that allows us to extend an LPC associate license.
There is under the Americans with Disability Act, but that's the only exception.
I don't think it was anything related to that.
Okay.
Dr. Bradley, I saw your hand raised. Take off mute. There you go.
Sorry. I agree with what y'all are saying. I just happen to be on the National NBC Assessment Committee, and that's what we're doing, is revising the NCE exam. And it's revised so that, just like any exam that's revised, so that people stay current in what's happening. So, I mean, if you take the exam in 2000 and then you take it again in 2005 or any 5-year period, 2000, there have been changes. And I suspect, I wasn't here when that rule came in for the 5 years, but I suspect that that's the reason, is to be sure that people are current.
Dr. Bradley, what do you happen not to be on? Or can you list out the organizations that you're not a part of for us? That would be a little bit easier, I think, maybe.
Let's just say I've been in the profession a long time, Chris, so
Yes, you have.
we'll stop there. How about that?
And thank you for your depth of knowledge and wisdom. It was always appreciated.
Absolutely. It's good to have you, representing us and keeping us well informed. So,
Dr. Muna, I'd like to get your thoughts. Any reason you would see to get rid of the 5-year deadline and make it
Not at
indefinite?
all. I kind of see it the same way as our recertification, because things are constantly changing. Even though we're licensed, we still have to do continuing education hours for all of the things that we're on. So I see maintaining that timeline is making sure that someone doesn't get comfortable or complacent, and they're just up to date, which is going to make you a better clinician for the people that you serve.
Board, is anyone in favor of the proposal? If so, let me hear your reasoning. Okay, I will entertain a motion if someone is ready. The motion would be to deny the petition.
Mr. Chair, just want to give the petitioner an option to speak if he's present, if that is agreeable.
If he's present, I'm okay with it.
Let me look.
Christina's checking.
Mr. Chair, can I also ask if the motion is to approve the letter sent out, or if they want a different response to change that?
Well, Mr. Attorney, what is cleaner?
Well, maybe after,
To approve your
I'll speak.
letter denying?
Sure.
Okay.
I do not see the name on the list. So if you are, if Cody Ellie is on the list, please raise your hand. I do not believe they are on the meeting.
All right, Mr. Chair, this time I'd like to make a motion to uphold the response to the petition as a denial.
That motion is to approve the denial of the petition.
Second.
And Janie with the second. All in favor of approving the response denying the petition, please raise your hand and state aye.
Aye.
And those opposed? Okay. That motion is approved. Thank you, Patrick. We'll move on to item 8, reports review.
All right. In your board packets, you all did receive all of the reports. The first one is the Q1 performance measure reports that has all of the data that Daryl gathers related to the overall agency. So there's lots of great information in there for you all. The second report is the Q1 informant status report. Again, you guys can see how the, we're still getting complaints to come in, but the investigations and enforcement staff continue to work very hard to get those numbers down. If you go back and look at our second quarter of fiscal year 21 compared to our current quarter, before we had opened 778 complaints. That's just for the LPC board, and we are down to 266. So that's great work. They continue to work hard. Now that we have Miss Victoria Benitez, I know it's just going to continue going. As far as I understand, we're still trying to get another attorney for the program because it is a larger program. But we are thankful and grateful to have her. Yes, Patrick.
We have a new one starting next week.
Awesome. All right.
Thank you.
So yeah, but
Is the new attorney here with us today?
yes.
Oh, wonderful. Victoria, welcome. Please let us know, let me know how I can help with complaints moving forward. Thank you.
Awesome. So we're very grateful to have her, and we can continue to get some work done for the program. So kudos to all of the investigations and enforcement department, which brings us into the Q1 complaints dismissal report. Again, those investigators are continuing to kick it out as quickly as possible. You do see there that of the complaints at this particular quarter, there were 68 total resolved complaints. And that is there for your records to review as well. Does anyone have any questions on the reports?
I had a question, and it is number 67, 2022-00004, sexual misconduct. It is labeled as untimely. What does untimely mean?
Outside the rule of limitations that we impose upon filing complaints. We have a rule of limitations for all complaints.
What is that
So-
rule? Could you refresh me, Daryl?
Oh,
I believe it's 7 years though from the
Okay.
termination of services.
Okay.
yeah. No, is it 7 or is it a little longer for,
I believe it's 7, but I'll double check real quick.
yeah,
Is that our rule or is that statute?
it's our rule.
Okay.
Does our rule parallel statute for sexual misconduct?
I believe it's a BHEC rule and it parallels.
It's a BHEC rule. It's not a board rule. Our rule, I know, let me see if I can find it here. I know the reason we have it is because it parallels the record retention schedule that you have. You don't want a complaint you don't want to be able to bring a complaint after the individual, has destroyed any records they have of that patient, because then you basically set up something where they can't defend themselves. And so that's why we have that.
The rule is 884.1.
And Ms. Stubblefield, if I remember correctly, I think we had language previously with that related to this as well. I'd have to look it up to see what it was previously, but I think we did still have it prior to BHEC.
Yeah, it's 7 years beyond the date of termination of services or within 5 years of the patient or client reaching the age of majority, whichever is greater. That's the rule for sexual misconduct.
And it related to the records. Any other questions on the reports?
Anything else, y'all? Okay, hearing none, we'll move on to item 9. SOA updates.
Patrick, I'm gonna throw this one to you.
I don't think we have anything for SOA cases this go around.
Okay.
Okay, we'll go on to item number 10. An update on our rulemaking. Adopted rule changes, those were approved by BHEC back on February 1st. These were the rule changes that now permit associates to own a business and associates to accept direct payment. There were no further comments by BHEC. I've just learned that the publication date for Texas Register is going to be February 18th, which gives the rule change an effective date of February 27th. Okay, so you can start getting word out that February 27th is the effective date for these proposed changes. Item B, possible discussion and a vote to adopt the proposed changes regarding our minutes and our schedule of sanctions. Do we need some background on that? The change to the minutes was the rule change allowing recorded minutes to suffice in place of written minutes, and the schedule of sanctions was more or less a house cleaning update. Is there any discussion on those? Okay, I will need a motion to adopt these changes.
So moved.
Thank you, Janie. Do I have a second? Dr. Bradley with a second. Thank you. All in favor of adopting 681.6 change to the minutes, 681.205 housekeeping work on the schedule of sanctions? Please raise your hand and state aye.
Aye.
Aye. Any opposition? Okay, seeing none. Tell you what, are y'all ready for a brief break? Or we want to keep moving ahead? Let's take 5 minutes before we move on to agenda item number 11. It is, I have 10:21. Let's reconvene at 10:26.
Christina, just pause the recording. Don't stop it.
Okay.
Welcome back, everybody. We'll move on to agenda item 11. Rules Committee tackled some language on continuing education standards. Christina, will you summarize the discussion for us?
Yes. So this is new proposed language for you all in new rule 681.140. Basically, it consolidates all of the continuing education requirements into one single rule, which now will require 3 hours of cultural diversity or competency. The JP will become optional, but if taken, can be used for 1 hour of ethics. And also licensees can now claim up to 1 hour of self-study continuing education credit. For the 141, 142, 143, and 145, these rules are being repealed because they're now going to be in that new 140. And then related to the 147, this rule is being proposed just because of the numbering in that rule. Since we're removing everything out of 142 and putting it in 140, we're just making that change to that specific language there.
Okay. Christina, what was the reasoning behind this? What is we're just cleaning stuff up?
Yeah, just cleaning it up, trying to consolidate all of the continuing education into one rule. We had them in multiple locations, so it could be a little confusing or more difficult for someone to find them and know exactly what courses. I mean, I'm sorry, not what courses, what continuing education and under that realm, what they needed to do. So it's basically just kind of cleaning it up, putting it all in one rule. And this is something that the standardization committee has also looked at, and we're trying to do this across boards.
Okay. Any questions for Christina on this or for the rules committee members? This one was not viewed as potentially controversial, but frankly, you never know. So any concerns, questions?
And it's just questions because I don't remember this when we looked at it before, but under F, it says licensees must obtain at least 50% of their continuing education from one or more of the following providers. I didn't remember us having a requirement of who they got their CEs from.
You don't currently. This is something we borrowed from the psychology rule, where psychology requires that half of their what they call professional development, everybody else calls continuing education, come from certain types of providers. And what it's designed to do is to keep people from just going to possibly unscrupulous sites. It ensures some measure of vetting of the providers by listing these types of entities that you have to get it from.
How will that be managed from a staff perspective?
Well, when they're under audit, we would look at it to see, did you get this continuing education from one of these providers on the list?
So you'll look at each of the certificates?
Yeah, that's what we do. We look at that to make sure it comes from one of those approved providers.
Was there any issue with the providers on the list?
I mean, I haven't really looked at, I just know that, goodness, I don't remember what year, but a few years ago, we took out that we weren't vetting providers, but now we're putting back in that there's a requirement for that they get it from certain providers.
Yeah, Janie, I can clear that up maybe a little bit. What we removed was the certification process. Right. So we still don't do that. This comes out of the BHEC Standardization Committee we've been kind of discussing, and there is, some concern about just having a qualified individual that's issuing it. So it's sort of like a list. It's not really anything that they don't go and get a certificate that allows them to be a CE provider. It just sort of says like, if it's an organization, like all organizations, TCA, those types of organizations, they're automatically on the list. Any licensed professional automatically on the list. It's just stopping Jim New Yorker from opening up a website saying, hey, I do CEs in Texas. Here's your Texas ethics. My name's Jim. I'm from New York. Right. Nothing against Jims or people from New York, but that's just kind of, it's just saying like, if you got a certificate that says Jim's New York CE parlor, like, BHEC will audit that and they'll say that doesn't qualify. That's all it is.
I'm actually still looking for the list in our meeting stuff.
There's
I don't believe the list exists yet, actually. I think it's kind of
okay.
works, isn't it, Daryl?
Yeah,
we don't actually generate a list. I mean, we list in the rules the types of providers that are approved providers, and we want that in a rule. We don't want a separate list to maintain.
Dr. Amuna, I'm looking at 681.140 proposed rule.
Mm-hmm.
I'm scrolling.
I do see that.
Yeah.
I was under the impression that we had like not to like I don't want to say a name, but like Fort Hood provider or HEB provider of CEU. So that's good that we don't have that specifications. Awesome. And I do like the concept of someone who's already licensed as a provider without having to go through an additional credentialing to provide CEUs. That's something that I've always loved about our state. Thanks, Daryl.
just wanted to make a comment. I just want to make sure that, you know, when we are doing our continuing ed, you know, there's a lot of different fees out there. So some CEs are offered at a better rate than others. So I just want to make sure that we don't get caught up with this little monopoly of having certain providers that we go to and then they sort of just hike up their rates, and because they know that that's who we need to go with 50%. So I want to make sure we're avoiding that.
Yeah, and Brenda, this doesn't have anything like that at all in it. It's just basically a very brief description of these are the entities that qualify to be CE providers. That's it, and it's a BHEC thing. So that's something that we'll kind of standardize across all the boards, not really just specific to LPCs, but it doesn't say anything like anyone would still be able to do CEs. They just have to fall under those criteria, which are very big and have a lot of room for access. So, I mean, it's not difficult to get onto that sort of list, so to speak, if that makes sense.
Mm-hmm. Thank you.
Carol, I think the one thing that the board does need to vote on, though, is the subsection B. There's an or, and I think the rules committee wanted the board to. The rules committee didn't make a recommendation. They left it for the board to consider.
Yeah, they need to pick which version of B they would want to go with if they're going to go with the rule.
Patrick, one more time, the specific number on that, so everybody can pull it up.
The 681.140 in subsection B regarding special continuing education requirements. There's a breakout of a B1 and 2 or just a B.
And Daryl, as I'm looking at these, they are saying the exact same
Thank
thing.
you.
You're just asking in terms of like how we're spacing it.
It's a stylistic choice. How do y'all want it? So, some boards have gone with the first version. I don't really care. I put over here in the comments that my preference was the first version, but I don't really care. However way y'all want to do it.
I agree. I think the first version is more succinct. It's to the point, and I think that's what I would recommend is number one.
Same.
I move we accept the first version of B subsection 1, subsection 2.
A second.
Second.
Okay, we have a motion and a second. Is there any discussion? And this is specifically on the version we're picking, not the total proposed changes, correct?
Correct.
Okay. Any discussion on Ms. Stubblefield's proposal that we go with version 1 of 681.140 B1 and 2? Okay, hearing none, we will vote. All in favor of accepting the first version of the proposed change, please raise your hand and state aye.
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 Okay, proposal passes. We will go with the first version. And it's my understanding that we do need to vote on whether we accept the proposed changes as a whole, so that those can then go to BHEC, correct?
I move that we accept these proposed changes as a whole to move forward to BHEC.
Okay, Pastor Royce seconded that motion. Any discussion? Hearing none. All in favor of accepting the proposed changes, please raise your hand and state aye.
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 Any opposed? Okay, seeing none, motion passes. We'll now move on to item B under possible action. Rules Committee met back in January. We had 4 stakeholder organizations that were invited to participate, and all 4 chose to participate. we were having a discussion on the originally proposed broad curriculum changes that we passed back in our September meeting, and then at my request at the BHEC level was sent back to the board. The board received it, and we decided let's proceed with more stakeholder involvement. So that's what the Rules Committee started with. To summarize the stakeholder participation, that was TCA, TASIS, Christian Counselors of Texas, and
LPC.
yeah, LPC Associates. They were all in agreement that they did not like the broad change as proposed. They expressed assorted concerns, but common themes were we are getting out of line with KCREP standards. We do not want to make changes that are perceived as watering down the academic requirements associated with the profession. And then there were some specific ones associated with each stakeholder organization. Rules Committee listened to those concerns. We received some, we came to kind of rough consensus that we would not like to proceed with the broad changes as originally proposed. But we did kind of discuss, and we pressed our stakeholder organizations on possible changes that they would be able to live with, or changes that they would view as a positive. Y'all, in the big picture, we're balancing a lot of things here. Number one, our directive is protecting the public. That is first and foremost every time on every single decision. But as I love to say, part of protecting the public is making sure that they have access to the finest therapists in this state. And so that's where the vigorous and high level of curriculum requirements come into play. And then another consideration that we balance is workload on staff. Staff is a state organization. They have a limited budget, and we like to make changes that can help them out, that ease the burden of delays in licensing. But we don't want to make any changes that come with an increased, or like the lawyer term here, a material risk to the public. I really wanted to have a product or something to discuss come out of the Rules Committee meeting. We did have a, like I say, a rough consensus that a change that we could live with was the elimination of the requirement of a second psychopathology course. Taking a look at the data that staff provided for us, what trips up a full two-thirds of applicants with counseling related degrees and who got dinged on a course curriculum requirement, two-thirds, it's that they don't have that second psychopathology course. So the way I viewed this as, if we were to eliminate the requirement of that second course, that knocks out two-thirds of what gets people dinged. That eases the burden on staff. And as I quizzed our stakeholders, as I quizzed the professional members on the Rules Committee, is that a change that can be made where we do not have a material increase to risk of harm to the public? Okay, there was some consensus agreement on that. And so at that point, I did request that Patrick draft some proposed language that reflects that, and you have that in your materials. And so in order to begin the discussion today, feel free to ask questions about why the Rules Committee is heading in a different direction. And let me know if you like the proposed change, you hate the proposed change, you think we should go in a completely different direction. I don't know if we will come to something definitive today, but I do want to, while we've got the full board together, I want to hear from you on, are we heading in the right direction? Or do we need to be doing something completely different? Do we want to blow the whole thing up? Do we want to go back to our original broad and sweeping change? I don't think that's the case. However, I did want to have a specific proposed language. It's the lawyer in me. I did want specific language that we can start from on this discussion. And like I said, this is, I view it as a compromise position. Like all good compromises, no one's completely happy. But if this can provide some flexibility on licensing to staff, that's a good thing. And I view this change, like I said, would eliminate 2/3 of what dings people on their curriculum requirements when they have a counseling related degree. So that's why it's a small change. There is a consensus opinion that it is not in a material increase of risk to the public. And like I said, it has a big impact, 2/3. So that's where we have a new version of proposed 68183. So we will have some discussion on what y'all think of that, on what you think of curriculum changes in general. And we've got all the staff here that can provide their perspective. Okay, Dr. Taylor, you want to weigh in on this one?
Sure. Thank you, Mr. Chair. I think the bigger issue that we're trying to resolve is the path forward for counseling related degrees. The issue with the academics, I think, kind of just got sort of like caught up in the middle of it. Our goal in the beginning was just to help those applicants that are applying with counseling related degrees not have to not get caught up in some of these things. So maybe that is a discussion that we should have with staff on how to better create a sorting mechanism for what is a counseling degree and what is a counseling related degree. I know like there's some things that are obvious, like psychology. Obviously, that's not a counseling degree, that's a counseling related degree. But addictions counseling, is that counseling or counseling related? My master's is a master's of counseling in biblical, or is a master's of biblical counseling. I mean, is that counseling or counseling related? And my school was not a K-CREP accredited school. But my academics did meet all of the requirements. So maybe that is I know it's a different conversation, but I think that was really the spirit of what we were trying to resolve, is to make this process easier for staff and make this process easier for individuals that have degrees that are not specifically counseling, but counseling related, without diluting the quality of our programs. We're not trying to send a message to anybody saying we don't care about academics. We care about them very much. But do that well while stopping these people from getting caught up in small issues. I don't know what the answer to that is. And I don't know if this is the exact moment to discuss that larger issue, or if we just need to discuss, what came out of the Rules Committee. But that's where I am.
Dr. Bradley, you're not part of the Rules Committee discussion. And when we originally proposed the broad change, you were the lone nay vote. I view you as an authority on this, and I want to hear your thoughts about whether you feel as though we are heading in the right direction, your thoughts on a change, removing a second psychopathology course, where you think it's absolutely required. That being said, I do agree with Dr. Taylor. A broader discussion on counseling degree versus counseling related is warranted. I don't think that we're going to be tackling that today, but like I stated, there is value in this discussion because I want to see where we're starting from and get a rough idea of what direction we're going to head. So, Dr. Bradley, I assume you've had a chance to review the new proposed change, and let me know your thoughts on it.
Well, I'm going to support the proposed change. However, I did not support what the Rules Committee brought before. And if you look at a petition signed by, I don't know, over 2,300 people, they did not feel it was in the best interest of the profession. So with regard to reducing, when I read this, what I understand, they don't have to have both abnormal and psychopathology. Now, this is interesting. I've got quite a bit of experience with this. Just this time last year, I was told, well, it was in September of 2020, I guess, that when BHEC looked at our program, we didn't have the psychopathology. And last spring, I got it through our curriculum committee quickly, and we added it. And I can tell you the two courses together, our two do not overlap, and it's been a good experience. But I'm going to go along with the proposal because I think it could be, you know, worked into one course. I'm just hoping that in that course that they not only learn about the DSM, but they learn about psychopharmacology. I taught that psychopharmacology for our department last summer, and students really liked that new bit of information. In other words, they'd had our abnormal course, and then they took the psychopathology. But as I said, I was totally against what was proposed, and I praise you, Dr. Hallbauer, for the Chair Hallbauer, the way that you handled this, that you took it back and that you looked at it, because I think it would have been very much of a mistake. And I think when you look at what the other professionals were saying, not just me, but out, you know, who are licensed, who brought forth the petition, I don't know exactly. But at any rate, I think you're doing the right thing. And I think this is a compromise, and I'll go along with that from my perspective. But I will say, I have found in our program, and our students have enjoyed and thought that it helped them to have both classes. Now, whether or not they have to have it, that's why I'm going to vote in support of this. Did I answer your question? You know, it seems like I went in two directions, but I came back to the fact, the focus that yes, I am going to support it.
You did answer my question. What I was curious about is, knowing that you were against the original proposed rule change, how you felt about this one, since you weren't part of the rules committee meeting.
I would encourage that, you know, that other change kind of took me by surprise, since I wasn't on the rules committee. I don't know. I think something of this magnitude needs to be thoroughly discussed and considered by the whole board.
We're going to go with Janie, and then followed by Dr. Amuna.
And I just need, and this is just because I haven't been in the classroom in, you know, in a couple minutes, but Dr. Bradley, Dr. Amuna, can you help vet out for me how the distinction between the abnormal class and the psychopathology class? Are they completely two different classes, or are they just kind of level one, level two?
Two different.
How are they different?
Well, I'll tell you how in our program, I might be able to screen share the course outlines, but I'll not try that. But I can tell you, the abnormal course deals with the different DSM. Well, it just focuses on the DSM. Okay, then when we get them to pharmacology, we looked at the different medications.
Not pharmacology, psychopathology.
Psychopathology, yes. I don't know why I said that. I was thinking about the medical aspect. But we look then at how, okay, you have a DSM classification, then what is done in terms of theory, what has worked with which group. We made them distinct, but I can see how they can be combined, and that's why I'm supporting it.
Yeah, and I'll add to Dr. Bradley. In the classes that I've taught with psychopathology, we focus more so on not just the diagnoses, but also on medical interactions, medication interactions, as it relates to psychotropic drugs. So as a clinician, if someone came to you and they said, I'm on this and I'm on that, you don't have to be a pharmacy tech to know that, hey, maybe the other mental health side effects that you're having is a product of these medications. And there are not many other places in a program where you'll get that type of knowledge outside of a psychopharmacology class that you would take as a CEU. You can discuss medication in abnormal psych, but it's not generally like a mandate or a requirement. It's more so the behavior and the diagnoses in abnormal. And it's a broad view as well of like how society looks at abnormal behavior as opposed to a psychopathology. You're looking at it more so as a clinician treating view.
Okay, so are you then basically using psychopathology and psychopharmacology synonymously?
No.
Okay, because my question is this, some of the transcripts, Daryl and Christina, that I understand come in with psychopathology, some come in with abnormal. And that's why I'm saying, are psychopathology and abnormal synonymous?
They're not synonymous, but they're similar. That's why when I mentioned earlier with the young lady, I think, who had the psychopathology, even though abnormal was there are some things that are discussed, but both classes can stand on their own completely separately. But it gave me comfort in knowing, okay, if she's had psychopathology, then she has an understanding of abnormal behavior, but not to the degree that you would get if your class, your entire 16 weeks was dedicated to purely abnormal behavior. I think for me with abnormal behavior, that's a 16-week course, same as psychopathology, but in abnormal, there may be a chapter on psychopathology related things and vice versa. In psychopathology, there may be a chapter on abnormal, but you're not getting the full extent of the information.
Dr. Amana stated that better than I did. We used two separate textbooks, and the course syllabi are different for the two courses. I'd say they're first cousins, but no place close to being twins.
Yeah, and if it helps, I was a pharmacy technician in Georgia after I became licensed as a clinician because I wanted to have a better understanding, because there are a lot of just medication interactions my clients were having. And so as a clinician, I just took that extra step to become a pharmacy technician just for knowledge purpose, not for practice purposes, but so I could have a better understand. And those were some of the things that I would have gotten in a advanced psychopathology course.
So do our licensees need both of those courses, or is a minimum of one what we need to be looking at for the standard? That's what's in question here, right? Chair Halbar? Do we need both or just one? I said chair.
Dr. Mina, were you just bored? Is that why you did that? Do you just not have enough going on in your life? Like,
yeah,
that is
hobby?
the discussion. Yeah, is the rules right now require two, and the question is one sufficient without a material risk, increase in the material risk to the public? Because going to one does give staff a little more flexibility on approval of counseling related degrees.
I think when we first had the conversation that at least I was aware of and a part of, I struggled with taking anything away. But of the things that we could take away, I think I struggled more with professional orientation. If that was ever thought of being taken away, I don't remember if you guys remember that was kind of on the table. So of the things that's being taken away now, I have more solace with the way things are, having just one requirement, as opposed to any other category that we would think of taking away.
Dr. Muna, that's a good point. What I really looked into on the concerns about requiring both ethics and professional orientation was that This applies when you have a counseling related degree, and it's all the more important if you have a counseling related degree, because having both ethics and professional orientation is just that much more important if you're coming from the related degrees. And so I did understand the concerns there. It's just that much more important for those degrees.
So as it stands today, in my humble opinion, I would say that it's palatable to live with having it as it stands, as it's written today.
All right, thank you.
I might add too. Oh, I'm sorry.
Yeah, this might help a little bit, Dr. Bradley. Christina, do we have a narrative for why we added this rule? I think we added it like 5 or 6 years ago. The second ethics course and the second psychopathology course. Do we have narratives on our discussion at the time? I know this was pre-YouTube, so.
Yeah, those were actually added, I believe, in 2013 or 14 into the board rules. So prior to my time.
Well, can we call Bobby or Glenda? Get them on speed dial? What were y'all doing?
Dr. Taylor,
do we have a narrative though? There should be a narrative in the Secretary of State's logs or register or something.
Hey,
yes, sir.
I think I'm allowed to say this. I talked to Chair Christofferson to get some background on the reasoning behind this. And he explained to me that it was done in an effort to reduce the complaints against licensed therapists. That was the reasoning behind it. The thing is, I don't know if anybody knows if there's been a demonstrable effect from
that. Was the second ethics one, right? But the additional, we also added that psychopathology or psychopathology at that time.
My mistake. That was, yeah, ethics was added to reduce complaints. I don't recall the reasoning behind the second psychopathology.
So yeah, I guess that's my question is, can we find a narrative for that? Either, I'm sure it would be in the footnote in the SOS filing.
There's nothing in the preamble that explains why it was adopted. We've looked it up.
Rules meeting, Patrick looked it up, and I don't think there was anything that helped us understand why it happened.
We were not efficient there, were we? All right.
We want to ask Jane.
Maybe.
Chris, do you want to ask Jan if she's on the call?
Jan is here.
Oh yeah, Jan, the
I don't want to put her on the spot, but
the historian, and historian, board's historian.
Jan, let me start off. I did not mean to put you on the spot here, but if you would like to comment on, if you recall, board discussion and reasoning on this.
On adding that additional course? Is that the question?
Second psychopathology requirement.
Yeah, sorry.
No, that's okay. Like I said,
I do not recall the specifics around that. I simply remembered the overarching rationale behind it was that there were so many issues going on with reimbursement rates and qualifications that the LPC board wanted to move to 60 hours without going to KCRAP, but go to the 60 hours to ensure that our folks would have better reimbursement opportunities. And there was lots of conversation. It was quite a dynamic process as to and compromises and so forth as to what courses were going to be included there. So I don't remember the specificity of the courses, but I do remember passionate dialogue.
thank you, Jan. Again, I apologize for that. Didn't mean to.
No worries. I appreciate the opportunity.
So I guess, Mr. Chair, is it? I mean, it seems that the addition of this course, I mean, other than maybe adding more requirements for the 60 hours, I mean, hasn't really had a significant impact in the day-to-day operations in our field in this state. It's kind of what I'm getting from everybody.
That's a good way to put it. Just again, outsider perspective, but I'm looking at we added a course 8 years ago, and nobody can really explain why we did it. And we're not sure if it had its desired effect. So that I think that's why we have the room to compromise right here, is because we just kind of have these general notions that it's good for you. And I don't know if that's enough of a justification that to hold up such a high percentage of our counseling related applicants.
Yeah, so I guess I want to ask the question, is this just like my mom telling me to eat my spinach, like, because it's good for you? Like, is it? I don't know. I mean, is it just moving this course? The second ethics course, I understand the argument for that was, you know, we have clinicians, and I experience this as a professor as well, is that just like students that just don't read the Texas, you know, ethics, right? And with the globalization of education, with students being able to be educated in any state and live here or move here very quickly, I see value in that. I don't know if it's had its desired effect necessarily. I don't know if we can quantify that and measure that. That's what I got.
Yeah. Okay. Public members, while I've got you here, would you, knowing that you've got a say in here, any concerns about you wondering if the therapist that the public is seeing, if they put it at a higher risk because they only had one course in psychopathology and not two? Pastor Roy or Vanessa, any?
No, I don't really have any concerns with it. I would be concerned, however, that they lap over enough to where the therapist is all right with giving advice or counseling in any regard. If they were okay with that and comfortable with that and with that level of professionalism, I would have no problem with it.
Okay, thank you.
Mm-hmm.
I think the only thing that I'm gleaning here is that if that's the only course they have, it sounds like they're continuing educations to further their education, so they will eventually have the option of taking other courses. And I know it's not regulated that they have to take courses in that subject, but I guess I don't see anything on the outset that says they would be incompetent to provide intelligent and research-based information. I believe that they're intelligent. They've proved that they are to get the degree. And I believe that you have to trust people are going to take the continuing education courses to further their education and their knowledge base. But that's just based on my own subjective opinion.
Okay, thank you. For our professional members, explain this to me. If we have somebody wants an LPC license, they have a psychology degree, they only have one psychopathology course that they took, how much additional learning does it require in order to pass the exam without that knowledge that they would have received from a second psychopathology course? What is the time and effort that they would have to put in to pass the exam?
So if I may, that's a little complicated, only in a sense that when you take the NCE, you're scored in different categories. And so they could score very low in that category, like abnormal psychopathology, and then score very high on group, on family, on individual counseling, and still make their way into a passing score, if that makes sense.
It does make sense.
So each category is weighted differently, but you don't have to excel in each category to pass, but there's a medium score you have to make in each category to pass. So if they're able to pass the NCE, then that means they have at least a moderate level of knowledge in that area. And Dr. Bradley, please elaborate more.
Okay. One of the things we could do would be to request from MBCC an item analysis and ask them to tell us, you know, how are people scoring in this category? Because Dr. Amana is correct. You know, you're scored by area. And like if you got a low score, she said, on one area, but you had a high score, you can balance out and still pass it. Now, there's no doubt in my mind that if you had two courses, your chances of scoring higher is increased. But the question is, if you have one course, are you likely to fail? And I know that on the EPCE exam, which is another MBCC exam, that we ask our programmer, I ask for an item analysis of each category till I can see if our courses are meeting or are preparing the students to pass that area and so forth. I'm assuming that NBCC, since they give that information on one exam, the EPCE exam, I feel reasonably sure they would have that data on the NCE, and that might help us. You know, can they break it out and tell us, you know, is this an area in which the people taking the exam score lower? And I know they do it for our program on the CPCE exam is based on the same 8 areas. It's a different exam than the NCE, but it's based on the same 8 K-CREP core areas. So an item analysis or just a category analysis might help this decision. But I don't have the research data on that. I do on the CPCE exam, but I don't on that. And I might add, I applaud you for keeping the abnormal in or the dysfunctional, whichever term, people use different terms, because I looked at the K-CREP standards and they do not require a course in abnormal, but they do expect that it be covered in a course. And when you have a K-CREP site team visiting programs, they check that out to be sure it's infused correctly. So it's great that you're keeping that and not eliminating it for 2 reasons. I mean, just performance.
I apologize. I did not see who raised their hand first. But Brenda, go ahead.
I was just going to say it would probably be really good to be able to obtain some of that data. Dr. Bradley, the other thing is, you know, it also depends on the version of the test that you get from the NCE, because, you know, you don't always get the same version, you know, and so back when I took it, I can tell you that if I raised my hand and put 2 fingers down, I couldn't tell you how many questions I got in psychopathology. There wasn't very many. It seems like the version that I took was highly focused on multicultural questions. I don't know if that's just what was going on at the time. And so they felt like that was just the most popular thing to do, but I couldn't tell you that I had a whole bunch of psychopathology or abnormal. So there again, I'm passing an exam. Was I ready? Well, the NCE said I was.
Well, you bring up an important point here, Brenda. And that is that there are parallel forms of the exam. So when we're asking that, why don't we ask for the data for the past 5 years, say, and then we can get a more of a longitudinal analysis. And again, I'm assuming they have that data, but I've never asked for it.
Mm-hmm.
Dr. Amuna, did you still want to comment?
I did. So one, Brenda, I was going to say exactly what you're saying is that the categories are weighted differently each year, each issuing of the test. So one year multicultural may be weighted more. The next year psychopathology may be weighted more. It changes. with each edition of the test. But also I've not seen in my almost 20-ish, next year will be 20 years of practicing, I've not seen anyone who's failed a category and passed the test. So just for like public members, it's not that you can get a 0 in psychopathology and still pass because your other scores are high. I've not seen that. There's always been a middle moderate area you have to make in an area, even if you're flying colors and everything else, to pass the NCE. If that helps a little bit.
Yeah, one thing I forgot to say, and I should have remembered that because I'm on that committee, the NC exam, the questions are randomized. So that's another important thing that I don't know why I forgot that, but I did. So that probably says you're not going to get an even number of questions in each category. That's why I thought you needed to look and ask for that category. But in one category, you may have a different number of questions. I'm positive that the questions are randomized.
They are, and I know that they have, I did reach out, they do have 6 different forms of the exam and 2 different ones for online. And it rotates, so they typically will not have the same exam if they have to go back to retest.
Mm-hmm.
Yeah, even if it was just a 100-question test and it was the same test for everybody, I still wouldn't advocate that it's our responsibility to determine if somebody has enough courses to pass the test or not. I mean, that's up to them and their school. I don't really see that as our scope is to, review the test and then say, okay, well, this is what Pearson's doing this year, everybody. So let's make a rule so that all the schools have to do what Pearson wants to do. I don't really see that as kind of our role.
I agree. I don't see it as our role, but I do want to make it so that everybody, I just want to give people the greatest opportunity that I can so that they will be successful and pass the NCE. If one course does it, I'm fine with that. If 2, but I agree, it's the university that's providing the academic coursework. But as a person that wants people to serve the state of Texas and to serve our citizens well, I want to come back and I want to be sure that the people applying for licensure, I want them to have every chance that we can offer so that they pass. I mean, I'm looking for success, and I'm sure.
Yeah, no, and I agree with that, Dr. Bradley. I definitely want them to be successful as well. But it just seems a little outside of our scope to make rules based off of what they decide to change in the test or not. And also, I don't know that we could keep up with that either. I mean, it takes up to 6 months if we fast track a rule to really get it through. A one like this has already taken 6 months just to get back here. So, I don't think we're going to be able to do that. And also, it's a separate safeguard, right? So the idea is that they have this education and they are able to pass this test and they are able to go through the application process and they are able to go through the supervision process. So I do view them as separate. I definitely agree they're overlapped a great amount. And we want to make sure all of our potential licensees are successful and that they do well in the test. But I would say their ability to pass the test should be left more up to the universities to help them take the courses they need to take and study the way that they need to study in order to pass that test.
Hey, board, if I'm reading the tea leaves correctly here, it sounds like that we're not ready to act on this at this point. We would like a little additional data before consideration of the proposed rule change. Is that kind of agreement on where we're at? I'm fine with that. I would like you to, at this point, sort of operate under the the direction that we are considering the proposed change as written. And that's the one that we want to operate from. Is this a yes or a no? So with additional data to help us make that decision, we can vote at another time. I mean, that's the impression I get, but if honestly, if somebody wanted to vote on the rule, we can still evaluate it as it works its way through the process. But I get the impression that we want additional information.
That is my impression, Mr. Chair. Also, it would help me a great deal if staff would put in writing the scope of the problem that we are trying to solve, so that we're all on the same page with the goal of what we are trying to resolve. So that might be, speeding up the application process. That might be clarifying the counseling related application process. That might be this particular course, the way it's phrased in current existence is causing X number of problems, which are resulting in a backlog of X number of people hours, people power. That would help me a great deal as I evaluate, a change in our academic requirements, if that's even required, and that might not be required. There might be another solution if we can best understand the problem.
Okay. If there are any motions, feel free to make them. Otherwise, this is gonna we're gonna keep moving ahead with consideration here outside of a motion. But if anyone has one, I'll give you the opportunity to make it at this time.
Chair Hallbauer, sorry, do we need to table this item so we can gather further data? Is that what we're needing?
That's what we're doing. If it requires memorialization, I'd be happy to do it. Patrick, what do you want to do?
I mean, I guess some of the options would be to send it back to the Rules Committee or to table it. If you take no action, it won't go any further with it unless you want to vote on it to propose it. So
I'm fine with tabling it and taking no action.
So moved.
Second.
Okay, Dr. Moon with the second. All in favor of tabling the proposed rule change in anticipation of additional data gathering and consideration, please raise your hand and say aye.
Aye.
Aye. Okay, that is tabled. Thanks, everyone. I do subscribe to the belief that there's always value in the discussion. And keep that in mind, though. This one isn't going away. We're still going to review it. Moving on, agenda item 12 is the counseling compact. I've requested that the counseling compact remain a standing item on every agenda that we have at our meetings because I consider it, and that's the impression I have from the board, is that we are in agreement that we consider it to be of the utmost importance. And this year, as we get ready for legislative session beginning roughly a year from now, the goal is to go through the legislative process and get this thing passed. And the best way to do that is consensus support from the board, from our stakeholder organizations, from staff, and make sure that I do not want Daryl to be in front of a committee and have someone ask him, hey, you say you want this compact passed, however, you haven't done this and this and this. And that's what we want to avoid. I have considered whether we would like to establish a new committee or possible labeling it as a subcommittee for focusing on issues associated with future compact membership. If there's any discussion about whether you would like the committee idea or hate the committee idea, I'd like to hear it now. That's the direction I would like to head on this. And when I say committee, I mean board members, staff members, and stakeholder organization participating in this, because it needs to be a united effort. Any
I think
opposition?
it's an excellent idea. I support it.
Thank you, Dr. Bradley.
I would agree. And I'm looking at the agenda and it just says discussion on Texas position. Daryl, is there anything out in the ether world in terms of where we are? Like, is there legislation that is ready to be proposed? Is there anybody that is going to be supporting? Any word on any of that?
No, we don't have any word on
Nothing
that.
yet? Okay.
Yeah, and that's really going to be in TCA's wheelhouse to secure a bill sponsor.
Okay. Then, I mean, I would agree that, you know, we need to have be proactive so that it goes through, you know, that we get some movement on it this next time, since it didn't get anything moved on it last legislative session.
Do we know who sponsored the bill or similar last time?
It has never been sponsored, if I understand correctly. We did have some legislation that worked its way through the previous session that we were in favor of. I don't recall who the sponsor was, but we did get, as I was told, 97% of the way there before it kind of unraveled. So we do have those in the legislature that are looking for ways to advance legislation that we believe is in the industry's best interest. However, it's not the board's job to go find a sponsor. That has to be accomplished through our stakeholder organizations, even though we do have consensus board support for this. So
Daryl, would a subcommittee be in conflict?
No, it's not a conflict. The only thing we have to do, we cannot use state funds to lobby the legislature. Now, you guys in your individual capacity can certainly reach out to your own representative and senator and say, hey, we'd like, you know, but while my opinion here is informed by my service on the board, I'd like you to consider carrying this bill. I mean, you could certainly do that, but I can't go over there as the executive director and go, hey, I'd like you to sponsor this bill for us. That's a no-no.
That's good, Daryl, to know, because we have had really good representatives in our area, House and Senate, who have been mental health advocates, at least on the higher ed level. And so I would imagine that those stakeholders hopefully are also aware of those individuals who've been supportive of mental health in higher ed, to reach out to them to be potential sponsors of the bill.
Yeah, Dr. Amuna, I believe in our previous meeting, you made an excellent point that this has such broad impact for the military community, and that gets political attention. And you're exactly right. What an incredible tool that we could add for those. How many out-of-state soldiers end up coming through Texas for a little while?
Well, and also spouses of soldiers who are already licensed in other states who are coming through. And, you know, I'm a rock's throw from Fort Hood's front gate. And so again, I know that those representatives are always here in this area, willing to help as it relates to mental health, higher ed, and as it relates to assisting soldiers and their families with, you know, quality of life here in Texas.
Okay. Yes, Dr. Bradley.
I think that's good points. And I think another point is portability of licensure. It's very important for the military, but it's also very important for counselors trying to come into Texas, counselors trying to go out. Right now, I just had some data this week. You know, 2 states have joined the compact, but there are 14 states right now in process. In other words, it's in some place in their legislative session. And I was told that it looks like North Carolina and probably, I think it was Tennessee, anyway, there are 2 states that are really close, but of course, there's got to be 10 states by this July or the compact dies, is what I have read and understand. So hopefully, because I think this would help portability generally and portability for military specifically and portability for counselors.
I believe that other state was Maryland. I'm not sure. That's Daryl, do you know?
I don't,
Maryland and Georgia have it. They've approved it. Those are the 2 states that have approved it. They've joined the compact, and there are 14 more. I know what the 14 are that are in process. So hopefully 2 have joined and just 8 more have to get it approved.
Yeah,
And
as a person who's licensed, currently actively licensed in 3 states, I am all for compact agreements.
Okay, does anyone have an issue with making this either a committee or subcommittee?
Great idea. Imagine if there wasn't compact counseling, Dr. Muna, we wouldn't have somebody great like you. We would have just passed you up because I know.
I just want to make sure Dr. Amuna is paying her renewal fees here, and I don't care about the other people. I just want your money, Doc.
Okay, can we have a committee that's comprised of staff and stakeholders, or is that a big no-no?
Well, you generally don't put staff on the committee. It's generally just the board members, and then we're here as a resource for you. Because I wouldn't put staff on the committee. We don't need to be voting or doing anything like that. We're just a resource. We're the grunts.
And we will hear from them as needed. Let's put it that way. Okay, so we're going to call this a subcommittee for Texas implementation of the counseling compact. Do I have any volunteers? Thank you, Dr. Amuna. And Brenda. I will certainly be willing to participate.
Yeah, all in favor.
Anybody else? This is not going to be one of those super governor appointed committees. This is going to be, we're going to stay fast and flexible. Dr.
I'll
Bradley?
volunteer if you need another person, but I'm okay if you don't need another person. I think committees can get too large.
How many people do you have on it now, Chair Hallbauer?
I have Dr. Muna, Ms. Campanone, Dr. Bradley, and myself. That's 4, and we would not want to risk creating a quorum, would we?
Correct.
Woohoo! I'm learning on the job. All right, thank y'all. I look forward to this. Will be the start of let's be the board that gets this done, and today is a good start to that. All right. We'll move on to item number 13, the board chair report. Would want to let you know Dr. Taylor and I participated in the BHEC meeting back on February 1st. We've already discussed BHEC approved our rule changes that now allow associates to own a business and accept direct payment. The next item of interest, a proposal to reduce the licensing fees, which was kind of a result of taking a look at the fees across all the boards. That passed at BHEC. This has a long way to go, just cautioning you. However, to the council's credit, they recognized that. We set an effective date for this of September 1st of 2023, following next year's legislative session. For LPCs, the proposal reduces the initial application fee, as we discussed. There's lots of little nuances to this, and there's a reason that the council decided that it would be best that we set an effective date in the future, because a lot of people are going to weigh in on it between now and September 1st of 2023. Daryl, anything to add to that?
No, sir.
Okay. Next, BHEC has their first, what they're calling the Insights Over the Lunch Hour presentation on February 28th at noon. This first one is going to be with the executive staff, including our Christina. And at the meeting, the council voted to approve these sessions for CE credit. That's good news. Give you just another reason to join. That being said, the transition to this is we'd like for our board to do 2, maybe 3 of these a year, specifically aimed at LPCs, but members of the other mental health profession could feel free to log on if they are interested in hearing counseling specific CEs. Kind of kicked around doing our first one in May and maybe a second one in the fall. Dr. Taylor has proposed making this first one in May about recognizing scams targeting attorneys. Mistake there. Scams targeting therapists and how to handle them. We have brought that discussion topic up at the previous meeting. The problem did not magically go away since last November, and so we are considering making this a how to recognize if you're being targeted for a scam and how to handle it. What obligations do you have to your patients, to protecting your license, just your livelihood in general. So,
Chair, I just wanted to be clear. I am pro scams for attorneys, though. I'm on board with that. That's okay.
We get targeted pretty often. We've got sucker written above our heads. So we're at this point, we are looking at the first LPC specific Insight Over the Lunch Hour being on scams, and Dr. Taylor has graciously agreed to take the lead on that. Again, we're looking at sometime in May, but this is open to everybody. Is there something that you'd like to present? Frankly, we could have one in the fall and we could call it, you've got an hour with the board, ask them whatever you want. That is essentially what the executive staff is doing in February, or in a couple of weeks, really. Or it can be something that you, how to avoid getting into trouble with the board. That's always been a popular topic. So anyway, it's something to keep in mind. If you want to take the lead on offering one of these presentations, please start thinking about it. Reach out to Christina with your idea if you want to take the lead on this. Any questions on that?
It's not as scary as you may think it is. We've actually already done one of these. This isn't our first one. This will be our second one at the BHEC level.
All right.
So I promise you it's not as scary as what you may think it is. I mean, you may get booed a little bit. We got booed a little, but you can mute them. That's a good thing.
And I was shaking my head earlier to having them ask anything that you want. I'd want a little bit of parameters, just in case someone was wondering what I had for breakfast. I might not want to share, you know. Nothing for breakfast. That's the answer, in case you're wondering. Nothing for breakfast.
All right, so keep that in mind. This is, I'm very in favor of therapist access to speak with the board. And this is a good way to do it. Next, the BHEC Strategic Planning Survey is up at the website. Please participate if you haven't done so. And it's important to know the deadline for that is coming up. It is Tuesday, this February 15th at 5 o'clock. Please get your comments in. This is your chance to kind of vote on what you would like to see BHEC doing, what you like, what you don't like. It's your chance to do it. And I'll wrap up BHEC with a question for Dr. Taylor. Is any updates from the standardization committee that you want to share?
We are standardizing.
Standardization is good.
Standardization is good.
Okay.
That's about it, really. We have a new psychology switched out their member, so Dr. Mark Cartwright. And we have a meeting on Monday, and we're just kind of discussing right now, I think, supervision, which is proving to be extremely difficult. but you know, we're working through it, and it is a wonderful, wonderful committee. I'm very honored to be on it, and I love working with our LMFT, social work and psychology compatriots as we continue to develop a shining new behavioral health agency. So,
Thank you, Dr. Taylor. All right, a couple more items from me. The BHEC Cybersecurity and Board Training Manual Acknowledgement Forms, they were due back by January 31st, and we received word from Christina that our board was 100% in compliance with this deadline.
We are
Thank you very
still,
much.
yeah, we are number one. So
Number
good
one.
job,
Were we
board.
the only ones that did that?
Yes.
Y'all were the first ones to get it.
We were the first ones to complete those requirements. Thank you, everybody. Appreciate that. Along those lines, on your reporting obligations, this is your first reminder. Your personal financial statement filing deadline is April 30th. If you have done it for the first time, it's a lot easier the next time you do it, unless you've sold all your Bitcoin or something crazy like that. This is your first, I put this as a reminder because that April 30th deadline happens before our next meeting. So again, let's maintain our great reputation with our reporting requirements. Everybody get that done. Like I said, it's a lot easier if you've done it the first time.
Daryl, are we required to report individual transactions inside of an IRA account?
You have to report the purchase or sale of like a mutual fund or a stock.
Yeah, but if it's inside of an IRA, do you have to report that?
I do. I do it in mine.
I don't care what you have to do, Daryl. Do I have to do it? That's what I'm asking.
I think so. I mean, that's why I do it.
The individual transactions inside of an IRA.
You and I need to have this talk offline.
Okay. It's a lot of transactions.
And last, I'd like to thank Sandra Martin and to all the Christian counselors of Texas for their invitation to attend last night's banquet during their conference that they're having right now. It was a delicious dinner and an informative presentation. And to be honest, I always enjoy opportunities to get out and interact with our stakeholder organizations, interact with therapists directly. I think they viewed me with some initial suspicion being from the board, but I quickly won them over with tales of all the great stuff that the board is tackling right now. So thank you, Sandra Martin. I enjoyed that. And a quick little recognition in regards to the Christian Counselors Banquet. Tim Spear, our Director of Operations, has agreed to join their conference tomorrow morning for the breakfast presentation. He's going to give a presentation about the operations of BHEC. So Tim, thank you for being willing to take a Saturday morning and go join the Christian Counselors. I think they're going to have a lot of questions for you because last night I told them, Tim will address that on Saturday.
I feel COVID coming on.
That wraps up my board chair report. We'll go ahead and move on to 14, the board administrator report.
Yes. So the biggest thing is a coming soon notice for all online reinstatement applications and written licensure verifications for all the boards. That's going to be coming online very soon. So thank you to all of our staff who work on that. We continue to, our licensing staff continue to work as quickly as possible, following rules. And, it's kind of a big reason we met today. They look at the rules and, what they've been trained on in the past. So I'm glad we were able to bring this, scenario to you guys and move forward. And we'll continue to work on this. As far as I understand, there should be hopefully pretty soon one more staff member to LPC, but we're not 100% sure on that. The one big thing that they wanted me to share with you all is for initial applications, it seems that the fingerprinting issue is still an issue with the initial applications online. So I know there may not be too many applicants on these type of meetings, but if you all can share and pass the word, the fingerprint information is going to be on their application summary. After they complete their application online, they're going to get an email with an application summary. In the body of that email are the instructions for the fingerprinting. So any of you who know, potential applicants or whatnot, just make sure they keep an eye out for that email. And any applicants that have deficiencies or whatnot, again, staff are sending those by email. Best way to respond, either if they have given you their direct email, you can respond to them directly. Otherwise, we really need to continue using the contact us form on our website. I have shared all that online with you guys before. Staff and Tim continues to work really hard on making sure we have as much information on the website as possible to help any questions that you guys may have, and not have to make that phone call and wait for a staff member to return your call to get those answers, to get those questions answered. So continue to use that contact us form, but otherwise, again, licensing and the enforcement department, investigations, everyone continues to work really hard, and having the resources here with BHEC has really helped us strive to a lot better position. And I thank the board members for all your work. I know we had a lot of material again today, but I appreciate all your time and commitment to the meetings and committee meetings as well. That's it.
Thank you, Christina. We'll now move on to public comment. The usual Open Meetings Act rules. You have 3 minutes for comment. Patrick, if you'll keep time, and then you'll give everybody a 30-second warning.
Okay, so anyone who is interested in public comment, please go ahead and raise your hand in the Zoom function, and I will go ahead and release you to speak. First one we have is Mr. Evans Spears.
Yes, hi. I am the chair for Department of Clinical Counseling and Mental Health at Texas Tech Health Sciences Center, the one that we were speaking on before. We're wanting just clarification to make it. Our assumption is now students who have already graduated with that exact same transcript, they are going to be allowed to be licensed, correct?
Mr. Spears, I did email you a few minutes ago that we would be reaching back out to you as soon as the meeting's over so that we can clarify some information with you. But the board today voted only on the 2 cases that they had presented in front of them.
Okay, thank you.
Absolutely. Okay, the next person we have is Dr. Bacon.
Good morning, almost afternoon, board. I am Dr. Catherine Bacon, the Texas Counseling Association volunteer liaison to the board. We appreciate the opportunity to provide public comment today. TCA does not have a formal position on the rule changes to section 681.140. However, the changes do align with previous written and public comment provided when previous changes to continuing education regulations were being considered. Regarding the changes to section 681.83, TCA appreciates the opportunity to engage with the Rules Committee during our invitation to the Rules Committee meeting a few weeks ago. The changes being considered to this section of the TAC align with our written and oral testimony provided to the Rules Committee, and we hope it will assist with processing of licensure applications while maintaining training standards. We also hope that further consideration will be given to allowing stakeholders to attend committee meetings on a regular basis. From our experience, this approach to shared governance would assist with smoother execution of future rule changes, as well as assist with stakeholder groups with information dissemination and education amongst the profession regarding board rules, processes, procedures, and policies. This in turn would assist with even smoother processes of licensure applications, reducing complaints, and improve efficiencies. Another example of this was illustrated in today's meeting with the discussion surrounding what is a counseling degree. TCA can be a resource to the Rules Committee and full board on this issue. and would like to be able to attend the upcoming Rules Committee and engage as a stakeholder. Regarding the Counseling Compact, one of the statutory changes we're specifically working on to make Texas eligible for the compact is to get diagnosis into the statute. And to echo Chair Hallbauer, we also hope that you are the board that gets this done, and we are working hard to help get that done. Thank you.
And Dr. Bacon.
Thank you, Dr. Bacon. Okay, next person we have is Dr. Kathy Ibanez Irante. I probably didn't say that right.
No, that's okay.
Oh, did I lose her? There we go.
There we go. Can you hear me now?
That was my fault. Yes, thank you.
That's okay. Thank you. You were very close. My name is Dr. Kathy Ibanez Llorente. I'm an associate professor at Texas State University, also an LPC and council approved supervisor. I wanted to thank the board for all of the work that you're doing, but in particular for the requirements of continuing education. The fact that you've added in 3 hours required continuing ed for cultural diversity and competency. I teach our advanced ethics course every semester, and I'll tell you that that is one thing that always strikes future counselors as a surprising thing, that they are not required to have continuing ed in that particular area. So when I brought it up this week that it was being proposed, that's a discussion now in that class that will be smoother with those students, knowing that you've already proposed that. So that's an excellent addition to the continuing ed for future counselors. I'd also like to note and thank for your support of stakeholders being involved in the rule making for academic course content, particularly the area of Texas Association for Counselor Education and Supervision, who are very closely tied to the understanding of curriculum processes within the university and what that looks like. I'm in agreement. I wasn't part of those meetings, but I'm also in agreement with the fact that you've combined psychopathology and abnormal human behavior. I know for our class, those two are more closely aligned than serving as two separate courses. So that'll make it a little easier. But I do appreciate the opportunity for those stakeholders to be part of the process, in addition to your support and involvement with the Counseling Compact. And as historically as I've been, I'm happy to serve as a reference for that, having worked on the compact, and I'll be working closely with TCA as well this year. So thank you for the opportunity. And again, thank you for all of your work for the board. Thank you.
Thank you.
Okay, next person we have is Angela Bowles.
Good morning. My name is Angela Bowles. I am an LPC supervisor and the TCA liaison in training. Thank you for allowing comments this morning and for the thoughtful consideration you have taken in preparing the work addressed in today's meeting. Specifically speaking to the work on Rule 681.83, we appreciate the opportunity to collaborate and provide input, and we do hope that the board will continue to engage with stakeholders in advance of voting on rule changes. This helps us feel heard and connected to the important work and role of in the service of these boards provide. Thank you. At this time, TCA has no official position on Rule 681.140, as this aligns with our historical position and on continuing education. We appreciate and respect the hard work of our volunteer boards. Thank you.
Thank you, Ms. Bowles. And it looks like the last person we have, unless anyone else raises their hand, is going to be Mario de la Garza.
Good morning, board members. My name is Mario de la Garza, and I serve as the liaison to the LPC board for the Texas Association for Counselor Education and Supervision. Thank you so much for your work today and the opportunity to offer public comment. I appreciate the discussion about counseling degrees and counseling related degrees. It sounds like you are working to make administrative review of licensee applicant materials easier and faster. However, you are also having to consider what rules you have in place in order to protect the public. Here's where the academic content standards are important. Continuing to review if those minimal standards are met protects the population of Texas because you are determining who has met minimal educational requirements and has the required knowledge and skills to competently practice in counseling. TASIS is thankful for the opportunity to provide written and public comment to the Rules Committee regarding proposed rule changes to academic course content requirements. We want to thank the board for its work in making that rule clearer and look forward to further consideration of this rule amendment in future meetings. It is important to hear from stakeholders. Making the committee meetings open to the public would allow for more input, collaboration, and transparency. TASIS is composed of counselor educators and supervisors throughout the state that have experience and knowledge regarding degrees, programs, and training requirements. I am confident that our members are willing to provide information on these topics when you think that it may be helpful. Thank you for working to position Texas to participate in the Interstate Counseling Compact. We appreciate the formation of the subcommittee to look more closely at it. I also want to echo what Dr. Ibanez Llorente said earlier about adding that requirement of cultural diversity to the continuing education. That is certainly something that is wanted, something that is needed. So we thank you for that. We look forward to having members of the board come to the TASIS Midwinter Conference on February 24th to present. So we're looking forward to having you there at our conference. As always, thank you so much for your service to counselors and to the Texas public.
Thank you, Mario.
Thank you, Mario. And it's actually, I don't think it's a phone call.
No. Any others?
Daryl, can I ask you for your opinion for that above the A? It starts with a 2.
142, that's not a
Yeah.
phone call.
Okay, it's not a phone call, so we're good.
Okay.
Thank you.
Thank you, everyone. Item 16, consideration for future committee and board meeting agendas. I realize that we kind of collect these during the course of the meeting, but if there's anything new that we haven't discussed that you would like to see added to a future agenda, please let me know right now. All right, hearing none, we'll move on to 17, announcements.
Oh, sure.
Okay. First of all, like Mario mentioned, TASIS conference is February 24th. We have a board presentation at 10 a.m. that morning, Thursday, the 24th. It will be Dr. Taylor, Dr. Bradley, and myself. The three of us will be there to represent the board, give an update to TASIS, and I assume that we'll take a few questions. Like I said, I always enjoy getting out and talking to people directly. Next, the AASCB virtual conference. I guess February 4th has already happened, so the 18th would be when that is the next.
Yes, and that's one that I am I'm participating in.
Okay.
So yes.
Future board meetings, May 6th. If I'm understanding how the progress on the new building is going, it will not be ready by May 6th. And so I would tell you to anticipate that May 6th will be the same format over Zoom. However, September 9th, there's a chance that the building will be ready. So kind of be thinking ahead. September 9th could be an in-person meeting in the new building. And our final meeting for the year is November 4th. And if you noticed,
one more thing on the meetings. I'm sorry.
Oh,
before you
go
go to
ahead.
this.
Sorry.
There is a proposed in your board packet. There was also a new meeting schedule for the next year that I needed you guys to look at and approve for 2023. So it was number 17 in your board packet. If you guys can just look at the last 3 meetings, we're not going to go after August because it's a new fiscal year in September. So if you can look at the next 3 proposed dates, and if you okay this with me, then I can go ahead and get it on the calendars, get it posted to the website. Yes, ma'am. I think Ms. Stubblefield.
I was just going to request that we not have our meetings in a week that already has a holiday in it. And I've not looked at the 2023 calendar to see if any of those fall in that. Like the September meeting is the week of Labor Day. So we're already have a holiday that week, and that would just be a request, personal request.
Okay. I will double check those 3 weeks that are there and bring it back to you at the next meeting. Just keep in mind that we are trying to make them align with the BHEC meetings. So we're trying to have our meetings, all the boards have their meetings prior to the BHEC meeting. So I'm going to do my very, very best. And do we want to continue to have meetings on Fridays as we have? Are Fridays the best days for everyone still? Okay.
You may check it.
Christina, I think the only one I see conflict, maybe that January 20th is going to fall during the week of Martin Luther King Day.
Okay.
That Monday would be a holiday. So.
Okay. Okay. I will definitely take a look at it. If you can just keep these out, on your calendar, see if they work. Next meeting, I'll bring you guys a new list, and we'll go from there. Thank you. And then yes, we have. Go ahead. Sorry.
Yeah. Oh, sorry, Dr. Bradley. Go ahead.
I was going to say, I'm not going to promise to an August meeting. That's the time I have vacation each year and some commitments. So I'll just see what that date, whatever my schedule is. I don't know it that far in advance, but typically I'm traveled during August when school's out. So we'll see.
Okay. All right, and finally, to wrap us up, y'all noticed that Garrett was absent today. Garrett has a 1-month-old baby, and this is about the cutest baby picture I've ever seen. So we'll share it. The baby was not feeling very well today, and so that's why Garrett was tied up. But welcome George Adam Nairn, who is 1 month old and will be a member of this board in, I guess, about 2052 or so. Maybe we'll still be there. But congratulations to Garrett. Been a long time for those days for me, and that's exciting for him. Any other personal announcements? I'd love to celebrate our personal accomplishments. So anything that you want to throw on here before we go? Pastor Roy?
Yes, I will be celebrating my 41st wedding anniversary this Valentine's Day.
Congratulations.
Proud of it. Thank you. She's a good girl. She's better to me than I am to her, I promise.
I know what that's like.
All right.
Congratulations. Anything else? Any other personal announcements? The standard wrap up. Yeah, go Vanessa.
I don't have an announcement, just a question, just an observation. I just actually don't feel like I do a whole lot. I just kind of sit and listen, and I'm getting educated on different things. But is this pretty normal for public members that sit on the board to just really be an observant and be effective in helping with the votes? And is there anything else that you guys think that we probably should contribute that we're not, or is this what we should do? Just wanting to understand more about our role.
Well, Vanessa, I apologize. I want you to feel as included as you want to be. And I'm happy to reach out. We can have a conversation because I know what that feels like. I'm a public member, and I remember the first few meetings just kind of wondering what was going on. And I would be happy to talk with you about ways that we can get you more involved. I'd love more participation if you're willing to do it.
I'm absolutely interested. Yes. Thank you.
Can I give you a call next week sometime?
Sure. Absolutely.
Okay. I'm happy to do that.
All right, thank you so much.
Thank you for being here, Vanessa.
Yeah, absolutely. I'm grateful for public members so that we're not being biased in our little LPC bubble, so that the things that we say are clear and that they're not biased. And sometimes we can be in our own speak and think we're doing what's good for the profession, but someone who's outside is going to say unbiasedly, hey, no, this is what I think. So I'm very grateful for the insight and input of the public members.
Thank
Yeah,
you.
Vanessa, a good mindset to have that I've learned as a public member is occasionally you need to say, y'all, hang on. You're talking this language that we don't understand, and you're proposing something that from the outside looks a little strange. So can you explain the reasoning on this? Because there's 30,000 licensed therapists in Texas, and there's 30 million non-licensed therapists, and the public members represent that 30 million. And it is our job to question, why are you doing this? Or is that a change that is going to increase the risk to the public? So I apologize. I want to get you more involved. I will give you a call next week.
Okay, thank you.
Thanks.
Anything else? Standard wrap up. I miss everybody. I'm looking forward to us getting back together in person, hopefully soon. Keep fingers crossed. Hopefully we'll be meeting, and I know we lose something doing this over Zoom, but I am grateful that you're still willing to give such a great effort even over Zoom. And I appreciate that. Take care. We'll wrap this up. We'll do a quick vote. If you think Bengals, raise your hand. Anybody for Bengals? Dr. Amuna and Brenda, and if you think Rams, raise your hand. Rams. Okay. I think it was tied 2-2. Everybody take care. Have a great weekend. Thank you for your service.
I need adjournment.
Oh, and a motion to adjourn. Brenda with a motion, a second to adjourn. Pastor Roy, all in favor?
Aye.
Everyone take care. Thank you.
Bye-bye.
Bye.